Comprehensive genetic profiling has been available for a number of years now. Priority Health was one of the first health plans in the country to cover next generation sequencing, but we covered it in very limited circumstances. Patients where there was limited tissue, especially in non-small cell lung cancer, and it made more economic sense to do a next gen sequencing rather than individual tumor analyses. We covered it in patients who had poor prognosis cancers, in which it was important to understand what the optimal therapy was the first time around. In patients who had successfully or unsuccessfully completed prior therapy and were interested in clinical trials. So we covered it in very limited circumstances because it was important to understand the molecular profile in making subsequent treatment decisions. I think the question of whether or not there's an economic value to testing is probably very dependent on what tissue type and what tumor type we're talking about. We've published some information with Foundation Medicine about the utility of next-gen sequencing and how physicians are using that information. I think as time progresses and physicians become more experienced in using those test results, we'll see greater utility